This is the Fix Your Sciatica podcast.
What are the best stretches for sciatica? Is stretching as good as they say it is? What stretches should I be doing? Why am I stretching in the first place? These questions are all very valid questions in the quest to treat your sciatica pain. The key to success in treating sciatica pain, though, is actually implementing the right tools and techniques at the right times. And today, we're going to talk specifically about the power of stretching. Now, the idea with stretching is to lengthen something that is shortened or tight. The reality is that muscles can feel tight, but not actually shortened. Tight muscles is a perception, just like how pain is. So I want you to envision some muscle fibers. An easy visualization is if you were to link your hands together and your fingers are alternating fibers, muscle fibers that actually run parallel to each other. The fingers on your right hand will move to the right, and the fingers on your left will move to the left. Just like how you can change the distance between your hands and fingers by moving them apart or closer together, the same thing can actually happen in muscles and muscle fibers. If your hands are close together, the muscle fibers are actually in a shortened position. And this is where muscles are actually truly tight because they're in a shortened position. This is usually due to inactivity or a significant growth spurt in teenagers. Here are the three most common muscles that get shortened and tight when dealing with sciatica pain. Number one, your hamstrings. If you work a very sedentary job, spending most of your time sitting, and when you're standing and your back is flat, your hamstrings might actually be in a shortened position. This often prevents you from being able to take a bigger step forward, or what the doctors call doing a straight leg raise, or simply being able to touch your toes. The normal range of motion for the straight leg raise is a pretty big range from 15 to 90 degrees, so slightly off the ground to completely upright. And you'll know that your hamstrings are, in fact, the culprit if the tension actually stops you from going any farther during the straight leg test rather than pain. If you feel pain during this test, you're most likely dealing with a herniated disc or a very sticky and sensitive sciatic nerve that does not like to be stretched. If your hamstrings are in fact tight and they feel better when they do get stretched out, then a hamstring stretch can actually be beneficial to you. One of my favorite ways to stretch out the hamstrings is by simply pulling your leg straight up into the air while your leg is supported by a towel or a strap. They kind of call it like the passive straight leg raise. I will say that I prefer a much more active motion rather than a static stretch. So what that means is that you are going to be pulling your leg up, getting into tension, and then getting out of tension. I usually do about 10 to 15 pulses to really focus on getting the blood flow moving and also getting those muscles truly stretched out. Another area or technique that you can use to actually lengthen your hamstrings would actually be practicing the hinge motion. During this time, you're actually going to be applying a stretch and moving at the same time. And I want you to think about focusing on pushing your butt back with relatively straight knees. And that actually allows you to lengthen the hamstrings at the level of the hip rather than moving your leg. The link to the hinging motion is actually going to be found in the show notes to give you a better visual representation. The second area is actually going to be the piriformis. The piriformis muscle is actually often a culprit in sciatica pain, and this is due to the anatomical placement of the muscle and its relation to the sciatic nerve. What does that mean? In most people, the sciatic nerve actually sits right underneath the piriformis, and when the piriformis is actually truly tight, it can actually put pressure on the nerve, causing localized buttock pain, as well as pain that radiates down to the leg. The piriformis muscle can be tight due to sitting for long periods of time and having what is called an anterior pelvic tilt. And what that means is when your pelvis is tilted forward, it's kind of like if your back is super arched. Now, this muscle, the piriformis, has to tense up in order to stabilize the pelvis. And you can actually test the flexibility of this muscle and see if it is or isn't tight by simply crossing one leg over the other while sitting with your hips at 90 degrees. So what does that mean? You're going to try sitting up with your knees bent and feet flat. You're going to cross one ankle on the top of the opposite knee. Are you able to get into this position? If not, then the piriformis is likely tight and it may actually benefit from being stretched out. Now, I prefer stretching this muscle out laying down on my back. What I'll do is I'll usually lay down with both knees bent, and then the side that I want to stretch out will actually be the ankle that I'm going to be crossing over to the other knee. I'm going to take my free hand and I'm going to push my knee so that my shin bone runs perpendicular in relation to myself, aka I'm creating a right angle, or runs across my body. What ends up happening is that I'll go in and out of tension to allow a stretch and release in the hip. And if this muscle is truly tight, you are going to notice an improvement in your range of motion and a reduction in your pain. The third area that often gets tight or truly tight in the shortened position will be your hip flexors. So if you're a desk-bound person, you might actually be dealing with tight hip flexors. Now, the hip flexor muscles actually attach to the front edge of your spine and actually inserts into the topmost portion of your thigh. And your hip flexors are actually responsible for turning in your leg, lifting your knee to your chest, but it's also responsible for arching your back. And when sitting down for a long period of time, your hip flexors become shortened and can be adaptively shortened over time, aka again compressed. That means that when you stand up, it can actually pull onto your low back into an arch, which is not favorable to some folks, or it turns into your leg, which places pressure on your piriformis muscle. So you can see that interrelatedness. We can actually address this muscle in two different ways. One is a simple knee to chest stretch, and the other is not a stretch at all. In fact, it is going to be a self-massage technique that happens on the front of your thigh, known as your quads. What you'll do is you'll take a foam roller, you'll lay on top of it, putting the area right on top of the roller. You'll actually notice that when addressing this muscle length is actually going to allow you to stand up a little bit taller, have less hip and groin pain, but also you'll have less sciatica pain, especially if the hip flexor is the culprit.
This episode is brought to you by the Patient Advocate Program. Are you tired of not having support between your rehab sessions? Introducing the Patient Advocate Program, and we're focused on your recovery, and we're offering you 24/7 access to a doctorate of physical therapy. Stop waiting in line to be seen and stop spending hours doing long exercise programs. Imagine being able to get all of your care delivered straight to your phone. Best of all, it's affordable. We believe everyone deserves top-notch relief without breaking the bank. So why wait? Take control of your health today and visit ptpatientadvocate.com and book your free call with our experts.
Now, we talked about shortened muscles, but what about the muscles that are lengthened but feel very tight? So I want you to imagine when your hands are together and they slowly drift apart, that means that the muscle fibers in your hands are actually going to be in a lengthened position. They're already stretched out. And when muscles and muscle fibers are in a lengthened position for a long period of time, your brain is actually going to create the perception of tension and tightness as a way to protect those muscles and prevent them from tearing. The sensation itself will tell you that it's tight, but when you actively move or stretch them, you actually have more than normal range of motion. And so here are a couple of the common muscles that can chronically be lengthened, but will feel tight. And as a result, stretching these muscles will only provide a temporary relief in symptoms, if not a worsening of your symptoms. The first one is going to be the hamstrings. Either your hamstrings can be short or they can be lengthened. So if you have an anterior pelvic tilt or your back is very, very arched, your hamstrings might actually feel very tight, but they may be adaptively lengthened. And what that means is, like previously before, when you have that posterior pelvic tilt, when your pelvis is tucked, it will actually shorten up the hamstrings, especially up at the level of the butt. But when your back is arched and your pelvis is rotating forward, I want you to think about that hamstring muscle getting lengthened for a long period of time. And you're going to notice that you're going to feel tight hamstrings, but your hamstrings aren't truly tight because you're going to be able to get your palms down to the ground. This is something where I find folks who are a little bit more on the flexible side are always saying, Ashley, I've been trying to stretch out my hamstrings because they feel tight, but it doesn't get any better. Now, again, when your pelvis is actually rotated forward, aka the anterior pelvic tilt, it does place a stretch on the hamstrings, and the tension is created as a way to protect the muscle to ensure that the muscle does not lengthen anymore. And again, this is probably why you've been stretching at your hamstrings with only temporary results. And when you're in this position, the low back actually does get a pinch because of the nerves running down, leading to sciatica pain. And so a way to actually address this hamstring tension due to lengthened hamstring is by ensuring that the abdomen is actually creating enough tension to support your body. Now, what does that mean? You can simply move into the opposite direction of your tilt, known as a posterior pelvic tilt. So again, simply tilting your pelvis can actually orient or reorient your hamstrings to take the tension out. So if your pelvis, again, is rocking forward, you can use your lower abs, aka the area between your belly button and your pubic bone, to rock the pelvis slightly backwards or tuck it in a way. Now, the goal with this is that when you do this, you have to ensure that you're not clenching your butt cheeks, because that can lead to a whole bunch of other issues as well. And when you're getting into that posterior pelvic tilt, you'll notice that your back is going to be a little less sore, and there might be a reduction in the tightness in the hamstrings, but also a significant improvement in your pain. The second area that can be lengthened would actually be your piriformis. So if you have a tight hip flexor, it's actually going to pull your back into an arch, aka the anterior pelvic tilt. And it's also going to pull your knees and thighs inwards. So it's kind of like looking at it as like a pigeon toe example. Not pigeon toes, we'll just say knees in. And as a result, your piriformis, which is an external rotator of the hip, especially in standing, is actually going to be stretched out. You're going to notice that your piriformis isn't truly, in fact, stretched out if you're actually able to cross one leg over the other without an issue. And crossing that leg actually increases your pain because you're stretching out an already stretched muscle. The piriformis already gets lengthened because we lose the core stability, especially with ab tension. So the question is, we've talked about ab tension in these two previously lengthened and tensioned muscles. Does that mean that you need to do more planks? Not necessarily, but it is important to think about letting your rib cage down slightly, which allows your abs to engage just a little bit. And another way to help your piriformis pain and especially if your piriformis is stretched out, is ensure that your hips are sitting right on top of your feet. You have to be aware that your hips are not jutting out to one side, and having one hip out to one side also stretches out the piriformis and glutes and can cause more pain. So the goal is to focus on some ab tension, but also keeping your shoulders sitting right on top of your hips. Now, one of the things I do get asked, especially when I'm talking about trying to correct this shift, is actually, well, what if one shoulder is lower than the other? And I had this conversation with a client the other day. I care less about the level of your shoulders, less than the relation of your shoulders and your hips. So what that means is, usually for the most part, your dominant shoulder is going to dip a little bit lower than the non-dominant. It's just due to the nature of us using our arms. So what you have to look at is there a straight line that runs between your shoulders and your hips? And is there an even amount of space between your arms and your torso? Because if you look at yourself in the mirror and you look crooked because your shoulders are shifted out to one side, we need to be able to correct that first before we do anything else. The third area that often gets overstretched because of tightness or feeling tight are actually the low back muscles, specifically the quadratus lumborum, the QLs, the multifidus or the multifidi, and the erectors. These muscles are going to feel tight because they're often overused and overactive. They often get tight because there's too much motion at the spine, and the back muscles need to contract to maintain stability or limit motion. And so I want you to think about it. It's like if you're stretching, you're doing the forward fold, you're doing knees to chest, you're trying to just stretch out your low back and it feels tight and it's not getting better. In fact, your back is getting worse. You might actually be using your back a little too much. But if your low back is in fact very tight, one of the most common low back stretches I see is a simple forward bend, as the back muscles are primary extensors, also known as back arching. Unfortunately, if you're dealing with a herniated disc and don't do well with rounding forward, the challenge is that how can we relieve that tightness without irritating the low back? And so the focus on reducing low back tightness that can be a cause of your pain is by stabilizing the pelvis by subtly contracting your abs and ensuring that you're hinging at your hips. That means that when you're bending over, your back stays a consistent shape. It's not overarched, it's not super rounded. And then you focus on driving your hips back like you're closing a car door. And this allows you to use your hips, your hamstrings, use your body in a way that is built specifically, reducing that perceived level of tension, which could be contributing to your back pain. Now, the only stretches for the low back that I recommend for clients are actually the ones that actually reduce the pain. What that means is that if bending forward gets rid of your pain, we're probably dealing with more arthritic stenosis or extension intolerance. We focus on bending forward. And then the same thing goes for any other direction. When you're dealing with pain, especially if it's caused by your back, you want to be able to find out which positions actually reduce your pain before you add on anything else. Now, stretches are a fantastic way to improve range of motion, and it can sometimes get rid of your pain, but it's not the only solution, and not everyone would benefit from stretching or should stretch. The key to your success is actually finding the best activities that make you feel the best, which can include stretching, exercises, or doing things a little differently. Next week, we're actually going to be talking about how to figure out if you should be strengthening certain parts of your body through exercise when dealing with sciatica pain.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.